I really like to use it on a lot of extremity issues. It seems to benefit a lot of people with plantar fasciitis. Get the fingers to relax. Good, easy. Long axis traction. So I will work the muscle in a shortened position, bend your elbow. Now Spider Woman me. Hit me with it. Got the fingers.
Oh.
Do you do it? There you go. Close. It's all right.
That's what.
Hey everyone, this is Dr. Warren Kalkstein at Kalkstein Chiropractic. I'm with Lauren today, and I'm going to show you the gold standard for how we treat carpal tunnel syndrome in our office. So something we see quite frequently, and there's a little triad of treatments that we combine to get really effective results for it. So we'll start with the first one, and this is class 4 laser. So Lauren here has carpal tunnel syndrome on her left hand, right? We did an exam with her. We found some positive nerve tension signs. The median nerve is being compressed. That's what carpal tunnel syndrome is, where it travels in this little carpal tunnel into the hand. So people usually complain of pain, numbness, tingling in their hands when they first wake up. In the night, they'll notice that they wake up with a little clenched hand in the morning. They feel a lot of discomfort in the forearm. A lot of times it's people that type a lot or write a lot. And it's kind of a chronic stress injury to that area. Okay, so now you know what it is, and you might have some of those symptoms. This is how we treat it, and it's really comfortable and it's really effective. So class 4 laser is deep heat, and it's using light therapy to penetrate deep to create pain relief in an area, to stimulate the tissue for recovery, right? And bring good blood flow to the nerve, okay? Good blood flow to the tissue so that when we are healing from that injury, it's effective. It's a little faster than normal. So deep heat to bring pain relief, tension relief, and blood flow to the tissue. Stimulates the cells in that area as well. So for her, I'm going to be working on this area here where that median nerve comes down and innervates these 3 fingers. I'm going to use this machine. It's class 4 therapy. And then you can kind of tell people, Lauren, how does this feel when I run the light over there?
It's a little bit of a warming sensation.
Pretty much straightforward. Deep heat, warming sensation, no pain with it. It's a really comfortable modality to use. I really like to use it on a lot of extremity issues. It seems to benefit a lot of people with plantar fasciitis. Some really painful foot pain that people can come in with. Carpal tunnel syndrome is something that can be really kind of stops you from your day-to-day activities, really affects you at work, affects you in your ability to sleep well. A lot of times people just brace it and try to get it better from there. And I think that combining these therapies in the office of deep heat, laser, soft tissue work, some modality I'm going to show you afterwards, and the adjustments to the wrist, okay? So this therapy that I'm doing now will probably last anywhere from 5 to 8 minutes, and I'm just going to give you the short run of it. So that's what I would start with Lauren if she came in with carpal tunnel syndrome on this left hand, okay? So get a little bit of heat in there. After we finish the session of the laser with Lauren, what I'll show you next is more of the soft tissue work. That's where I'm going to use my hands to get her hand to move better. So you can keep jamming out at your concerts, Lauren.
Yeah.
Having fun. You got any lined up anytime soon?
Nothing on the schedule currently.
Really?
Surprisingly.
It's a first, Lauren.
I
All right, do me a favor. Come up onto your back for me.
Okay.
I'm just going to use the table. This is the adjustment table. This is what we use in the office to do a lot of our therapies on. It's really effective because it puts people in comfortable positions really easily. So I'm just going to show you a little bit of an elevated spot. We'll stop right there.
Perfect.
Okay, I'm going to come over to your left side because that's what we're working on. So this is ART. This is a form of soft tissue work we're going to do on Lauren's forearm and hand, okay? And you can relax.
Okay.
So Lauren doesn't actually have carpal tunnel syndrome, right? But this is how I would approach it if a patient did come in with it, right? I would be working on what's called the flexor group. So all these muscles that come down and help flex the hand. I want to get this tissue to relax and open up so that that median nerve isn't so compressed down like this, right? Now, ART is a pin and stretch type of technique, so I will work the muscle in a shortened position, bend your elbow. Now, Spider Woman me. Hit me with it. Got the fingers.
Oh.
Do you do it? There you go. Close. It's all right.
That's what.
We'll warm up for that for the casting of the next one.
Yeah.
There you go. All good. And so ART is something I use on a lot of different soft tissue injuries, and spinal complaints that I see in the office. If you're in school and you're thinking about getting certified, or I highly recommend it. They've got great instructors. It was one of the better classes that I took for my my continued education, if you will, going through school. And yeah, I use it almost on every other patient, I feel like. So nice and smooth, good passes. My pressure isn't too intense, right?
Yep.
It should feel comfortable for you.
Yeah.
And then as I'm building up a little momentum, I'll start to kind of get some layers to this. So I'll really add in some pressure as I'm getting deeper into it. So then I'm going to work my way up to where that problem is. So that fascia is literally constricting around that nerve. And I want to try to get this to open up, get this to release, get this pressure off the nerve, get the tissue to stop being such a so provocative for the pain that she's experienced. So I'll work on the actual retinaculum below and above the nerve, and you'll start to feel that kind of that pressure that almost like feels like bubble wrap underneath my thumb. That's just fascia. I'm pushing through. Good. So a couple easy passes here.
Does feel like bubble wrap.
That's great. It's cool though.
Yeah.
So that's how I'll spend time above it. And I'm gonna, below it, and then I'm gonna also work above it a little bit. So I'll show you how I get into this palmar fascia. Okay, so flip your hand, okay? Go ahead, spread your fingers out wide like this. Yep. I'm gonna curl my hand underneath. So it looks like this on the bottom side. Bend your wrist a little bit and relax your hand and arm for me.
Yep.
And then sometimes with patients, I'll just show you how to do this. Relax your head back for me. That'll help you just let go a little bit more. Just enjoy this.
Just watching.
Yeah, for sure. No worries. Good. And stretching you out like this. Okay. So if I get somebody coming in with really bad hand pain, this is such a nice way to stretch out. I'll try to do a little reverse for you so you can see it. Stretch out underneath my fingertips, getting that palm, that fascia to relax. And I can work all the way, like people have trigger fingers, people have climbing injuries in their fingertips, people have psoriatic arthritis or even osteoarthritis of the fingers. Like this really relaxes the tissues and the tendons and the muscles of the finger. It's a really great, it's another ART technique, but it's a great way to relax the hand muscles and to get this tissue to relax, have less discomfort. Here. And I'm going to be a little bit more patient on this pass and really get it to open up, but I can't do it as well with my body forward like that. Relax here. Big stretch. Nice. Lauren, you from the Midwest?
Yes, Kansas City.
Kansas City, here on the East Coast. Been working in our office for the last, put me on the spot.
5 months or so? Yeah.
Oh gosh, I didn't even take that.
Yeah, you did good.
5 months here, and been awesome. It's been a lot of fun working with you. Big fan of music. You like the band Fish a lot?
Yeah.
And then a lot of other bands too, right?
Yeah.
Second on that list. If you're gonna have to do it, don't worry about this being cemented in second place. But if you had to, what's your second favorite?
Yeah. I like this artist Keller Williams. He's a solo artist, but in general, I just like artists that kind of defy genres and piece them all together. Different bluegrass, folk, rock,
Cool.
funk, all that.
Okay, fun. Keller Williams, I saw him once at the old Rock House in St. Louis.
And I was there too.
Were you?
Yeah.
Oh, we were at the same show?
Yeah.
Oh, because he only played there, was that 2018?
Something like that.
Shit.
17, 18.
Yeah.
Yeah.
Okay, right on.
Pretty cool.
That's cool. So we didn't know each other back then. And he was like, he had probably like 15 different instruments on him. It felt like he was playing like so many different things, and he was looping stuff back and forth.
Yeah.
He's quite the musician.
Very talented guy.
Yeah. So now I'm going to show you, I showed you some soft tissue work. The flexor group of the forearm, the retinaculum where that median nerve travels, and the palmar fascia, that last little soft tissue technique I showed you. That really does quite a bit for this type of problem. And then my background is definitely in chiropractic, and manipulation or adjustments are a part of that. And I'll show you how I adjust the wrist, okay? A lot of times it's more of a spread than it is a high velocity, low amplitude adjustment. That's where you hear and see a lot of the pops you see on YouTube or maybe in our own office, right? It's a little bit more of a spread. So you'll feel a little bit of the joints moving underneath, and that's just hard things moving over other hard things. There's a lot of tendons here, so it's those pops.
Yep.
That's all that is.
Mm-hmm.
So I'm gonna mobilize this joint. She actually probably could use a little bit of this from time to time, just because you do a lot of pressing with your hands, a lot of downward positions, yoga or overhead. You do a lot of like standing, wall-mounted, flamingo type activities with your hands on the ground.
Handstands.
Handstands, that's it. That's the name of it.
Flamingo stuff.
Flamingo stuff.
Whatever.
Okay, relax. I don't know the names of it all, but
it's all good.
impressive stuff. Like for the first week I came in, she was working out. We have a gym in our office in our practice. And I'm like, are those feet up there? Like, what's going on over there? And you're doing like a pure handstand in the middle of the floor, doing push-ups out of it. Pretty sweet. Okay, relax. So this is where I'll get some extension in that wrist. And then I might do a little pop like that. Get a little release. Really awesome. Get the fingers to relax. Good. Easy. Long axis traction. Does this cause arthritis in the hands? No. No, it doesn't. Good. And then, last but not least, follow up on that retinaculum. I'm going to pull my fingers apart and spread the carpal. So I'm going like this with my fingertips. I'm pulling right over that retinaculum, and then I'm taking my thumb and I'm pushing at the same time so that I can roll the joints away from that nerve and get it to release a little bit more. So, gold standard for approaching carpal tunnel syndrome. Class 4 laser, over the problem, helps with pain, helps with mobility in that tissue. ART, soft tissue work to relax. Oh, swimming now with that hand, right?
That's amazing.
Cool. And then follow up with the joints, getting the joints to release, getting the joint tension to decrease in the hand. And then that's what we do here. And you follow up with stretches and McKenzie exercises for the wrist. So that combination of care and at-home exercises are what make us really effective in managing carpal tunnel in as little as like 4 visits. So, hey, if you got it, if you know somebody that has it, hasn't tried those things out, it's really quick and it's a comfortable way. Like, it feels awesome to get it worked on. Thanks for watching.